Hello and welcome to the Botanical Biohacking Podcast. We have an incredible 8-part series combining the perspectives of a doctor of Chinese medicine, a doctor of Western medicine, and an herbal pharmacologist. By combining these vantage points, we get unique insight into the nature of pain and what the strategies we can use to overcome chronic pain and fatigue. This is something we see all the time with fibromyalgia, chronic fatigue syndrome, irritable bowel disorder, basically a lot of the chronic disorders which have been associated with pain. We find that these pains are speaking to us. And by looking at the herbal pharmacology, by looking at the perspective of a very experienced MD and from yours truly, a doctor of Chinese medicine, we can really unlock the keys to what the body is trying to tell us. Today we're going to be looking at formulas which have been said traditionally to boost qi. So the first 4 stages dealing with chronic disease, particularly pain and inflammation like chronic fatigue, fibromyalgia, and depression, have to do with removing obstructions that may be stopping forward momentum. So we could think of it like a stick in the spokes of your bicycle. Once you take out the stick, it's still necessary to begin pedaling to regain momentum. It may also be important to repair any damage that happened to the bicycle as a result of having a stick in it. So these next 4 stages have to do with building up qi, building up blood, building up yin, and building up yang. These concepts mean really nothing in terms of modern medicine, but by exploring the pharmacology of herbal formulas which have been said to do this, we hope to gain a clearer picture of what these may mean and how we can formulate healing strategies across the board.
So in Western medicine, I think what we're starting to talk about is the use of energy and to repair damaged cells. And the use of energy always comes down to the activity of the mitochondria. Mitochondria are very interesting structures in our bodies. It may actually be that these were some forms of adventitious bacteria that entered our bodies through our guts and had this organelle that was extremely efficient at producing energy.
It was back when we were only a gut, right?
That's back when we were only a gut. Yeah, this goes way, way back. These structures within ourselves produce all of the energy that's necessary for our cells to survive. Our cells use energy for different activities, movement of our muscles, and what ends up happening is that the energy substrate, something that is most commonly called ATP, adenosine triphosphate, is used up as a source of energy, and then it has to be rebuilt. And part of that process of rebuilding the ATP energy source is that reactive species, things called free radicals, are created that are extremely damaging to cells. And those free radicals need to be removed, and that process, in addition, requires energy. And all of that energy comes from the mitochondria. We've known in Western medicine for quite some time about a lot of the structure and a lot of the activities of the mitochondria. And interestingly enough, we don't have any medicines that work very well on supporting the mitochondria. We have a lot of drugs that we know damage the mitochondria, but we don't have much that really supports the mitochondria. What's the story from the viewpoint of Chinese medicine?
The viewpoint from Chinese medicine is that it's boosting gas in the body, and the word for gas, qi, has an energetic connotation. Its character is literally gas, but it has an understanding that's associated with energy and movement. Formulas and herbs in this classification tend to act on nitric oxide. When nitric oxide is too low or too high, it can interfere with mitochondrial production of ATP. When it hits a sweet spot, it really can help to improve mitochondria and increase their output of ATP. So it's not exactly energy in itself, but it seems to be acting as a catalyst for energy production.
So if I have a very low blood sugar, I may have seizures and become comatose. If I have too much blood sugar, as a diabetic might, I will become lethargic and comatose, but there's a sweet spot where my body absolutely requires the presence of glucose, sugar, in order for different tissues in my body to work, such as the brain. Same kind of sweet spot?
Exactly, same kind of sweet spot. And the same gas has also been associated with, when it gets to the pancreas, releasing the pancreatic enzymes that may help to keep the blood sugar stabilized as well. So it has overarching effects on energy production, maintenance, and distribution. But by itself, the gas has no particular qualities to it, except that it's a gas in motion. It's not necessarily energy in and of itself.
I'm curious, what we know or have focused on in Western medicine is that certain tissues have very high energy needs. And the tissues that we focus on are brain, nerve tissue, muscles, skeletal muscles, heart muscles, intestinal muscles, and the intestinal lining. Also, our endocrine cells have a pretty high energy requirement. Does that fall in line with your understanding of qi?
From a couple of standpoints. One, gases, particularly gasotransmitters like nitric oxide, like hydrogen sulfide, have been shown to have regulatory effects on the endocrine system. And likewise, the endocrine system will in turn affect them back. As far as the distribution and balance of the body, it seems to be having an effect on that, which in turn will influence energy production and maintenance. And in addition, its effect on mitochondria are also sort of paying the tab at every step of the way, because every one of these chemical processes, or most of them, is going to involve ATP at some link in the metabolic chain.
Yes, and one of the things that's just beginning to be understood about the production of ATP, and we get into what can be kind of a woo-woo area of medicine. I don't want to take it there.
I do. I'm going to wear a wizard hat.
Different from the one you already have on?
Yeah, purple.
Okay. Is it's called quantum biology. It is starting to be recognized that there are regular mechanical effects in cells, regular energy effects, but there may also be quantum channels in cells. And the example that I think of is pushing a boulder up over a hill. And it requires a lot of energy to get the boulder up to the top of the hill before it can roll down. Well, if there is a tunnel at the bottom of the hill that goes straight across to the other side, maybe even slanting down a little bit. It requires very little energy to get the boulder into the other side of the hill. And there is research being done now on these quantum channels, especially within plant materials. Chlorophyll activities with sunlight appear to have a great deal to do with quantum channeling. And there are great similarities between human mitochondria and the chloroplasts in plants that collect sunlight and convert that into energy. And I've started to see some research talking about the effects of different herbs on these quantum channeling that occurs in chloroplasts as well as in mitochondria.
That sounds like a very efficient shortcut.
And I wish I could pole vault over a 30-foot thing in the Olympics by channeling underneath the bar and still be credited with the gold medal.
But in terms of quantum biology, it's just fine to take those shortcuts. There's no long-term cost or anything like this.
No, you get double gold for.
I see. So the nature loves efficiency, and by way of this quantum biology, much of this is enzyme activity, isn't it?
Exactly, right. And there are 4 known enzymes in the mitochondrial chain, and it appears that some of those enzymes can make use of these quantum effects.
Enzymes, I think, are really interesting because they don't really add or take away anything, but they serve as catalysts. So they're not the superhero in the movie. They're the idiot who's kind of bumbling through and makes everything happen. So moves the story along.
Exactly. So you can imagine that if you've got all this damage in our cells after we've had a massive infection, or after a period of time where we've been suffering with the effects of fibromyalgia or chronic fatigue or depression, and we've cleared out all the dead wood from the spokes, and now we need to use energy to rebuild those cells. It can be a daunting task to push up over the top of the hill, but if we have the help of different enzymes that are made more efficient by herbal mechanisms, we can do the repair with less cost to ourselves.
And by acting on the mitochondria to increase ATP, it's kind of like post-war Japan or post-war Germany. You know, the U.S. pumped a lot of money into them, and then they're even better off after the fact. They're able to recover so much faster with this energetic investment. In the same way, it's not just dumping money into an area that's been war-torn, it's also improving the infrastructure at the same time, because as we know, just tossing money into a bad situation doesn't make the situation better. It can make it worse in many cases. So improving that quantum biological infrastructure at the same time as increasing the ATP can be a very efficient pathway toward healing.
Right. What I've heard you talk about in the past with the initial 4 stages of healing this process, if we put these herbs into the swamp, these herbs would just ferment along with everything else and be a waste of our time and effort.
Yeah, absolutely. Some of these formulas as well, they tend to slightly increase inflammation and increase macrophage activity, which may or may not be useful in an inflammatory situation. You might want to drop those initially. But when it comes to rebuilding, then a little bit of macrophage activity can help to scour away tissue that's dead and also help in the rebuilding process.
And that's the journey that we're on now, rebuilding our minds and our hearts and our souls and the body that carries us around so well when it's nurtured.
One of the signs that you're in a state of called deficiency, so the first 4 stages, something is blocked more than it's empty. That tends to manifest with a breathing pattern that focuses more on the exhalation than the inhalation. So people may sigh, not always, some people do, but if you watch the breathing, it tends to go out with a little more force. In this stage, people will begin to yawn by themselves. If you want to know which stage you're at, lie down on a bed and begin sighing. And if you yawn right away, you're probably more on the empty side of things rather than having it blocked. If you're able to sigh for hours and it feels good and it's beneficial to the body, but you're not getting to the yawning stage, you may be in more of the first 4 stages than the second 4. And it's not completely linear, it kind of zigs and zags and spirals, but getting an idea for where you are will tell you when you need to fill and when you need to look for those sticks that may be in the spokes of your bike.
I often see patients and I'll ask them, how bad is your pain, 0 to 10? And folks who are in the early stages, they almost always sound like this. Oh, 9. That deep, deep sigh that just comes out unconsciously. And later in treatment, they may start saying to me, with a big yawn, oh, excuse me, 8 or 9. And I know that the pain is still being perceived perhaps at about the same level, but something has shifted and it's time to move on to different levels of treatment.
One of the best ways to address this is to look at the efficiency of breathing and the efficiency of digestion, because ultimately that's where we're able to absorb our energy sources. So the cleaner the diet, the cleaner the breathing, the deeper the breathing, the faster this stage of recovery tends to be. Fascinating information. Thank you so much, Dr. Tom Whalen and Dr. Cho Shui Lan. Next week, we'll be covering another aspect of pain and exploring what the body is trying to tell us. Thanks again. This is Andrew Miles with Botanical Biohacking. Please remember to rate and review on Stitcher and iTunes. We love those 5-star reviews. They help other people to see this podcast. And also, please feel free to send a link to this podcast, refer it to your family and friends. This is how we keep the word out and we can help people to help themselves.